Hello, my name is Annie Lee, and thank you for joining me today. I will be presenting on depression, the use of animal-assisted interventions, and the need for a One Health concept in medicine. This topic was approved by Dr. Badassi, the One Health course director. So what is One Health, you may ask? According to the CDC, One Health is defined as a collaborative, multi-sectorial, and transdisciplinary approach to achieving optimal health outcomes with recognizing the interconnection between people, animals, plants, and their shared environment, promoting collaboration and communication between physicians, veterinarians, and ecologists in effort to monitor, control, and understand public health threats will ensure better outcomes. This approach is important in today's presentation on AAI use in depression. Depression, also known as major depressive disorder or clinical depression, is a common but serious mood disorder. It affects how you feel, think, and everyday activities like eating, sleeping, or working. In serious cases, it can lead to suicide. Why does depression exist? One suggestion is derived from the fertile ground theory, which says that vulnerabilities in the human mood regulating system causes the inability to cope with stressors. Episodic misfiring in areas of the brain, specifically the left frontal and temporal lobes, occurs as a result of genetic, environmental, social, and physiological factors. This is concluded from clinical observations of stroke patients who were found to be at a greater risk of depression if their stroke occurred on the left side of their brain, especially the left frontal lobe. Another link of depression is an imbalance of neurotransmitters in the brain, which are chemicals that regulate mood and emotion. Specifically, serotonin, norepinephrine, and dopamine are affected. As a result, they become targeted areas of pharmaceutical treatment. Globally, over 300 million people of all ages suffer from depression. It is the leading cause of disability worldwide. Severe cases of depression can lead to suicide, which accounts for about 800,000 deaths every year. And less than 50% of individuals with depression seek treatment. Depression is not contagious nor infectious. There are no vectors or reservoirs involved, and the direct cause is still unknown. Current research suggests that depression may be due to a combination of things, including genetics, biological, environmental, and psychological factors. Regardless, depression can occur at any age and at any time. There are certain risk factors that increase the likelihood of developing depression. Some include having relatives with depression, experiencing traumatic or stressful events, having a medical problem, taking certain medications, and using alcohol or drugs. High-risk groups include women, who are 2 times more likely to develop depression than men, ages 45 to 65, Blacks and Hispanic Americans, and individuals living in poverty, with correlations of less education, economic instability, and limited access to care. But please remember that depression does not discriminate based on age, race, or class. Some signs and symptoms that may be experienced include, but are not limited to, feeling sad or anxious all the time or most of the time, not wanting to do activities that used to be fun, feeling irritable, restless, having issues with sleeping and appetite, having issues concentrating, feeling tired or helpless, and also thinking about suicide. But once again, symptoms will vary from individual to individual. A medical provider will conduct an assessment to rule out other health problems that can be similar or contribute to depression. Then, depending on their training, they will conduct a further psychological evaluation or provide a referral to see a trained mental health provider. The mental health provider will ask questions using the diagnostic tool called Diagnostic and Statistical Manual of Mental Disorder, or DSM for short, which provides specific criteria for the clinical depression diagnosis. Some of this criteria includes impairment of daily living, having a minimum of 5 out of 9 symptoms for a continued duration of at least 2 weeks, and one of those symptoms has to be at least either depressed mood or loss of interest or pleasure. The other 4 symptoms can be reflected in the mnemonic SIGI-CAPS, which stands for sleep, interest, guilt, energy, concentration, appetite, psychomotor functioning, and suicide. Depression is treatable, and early intervention will lead to more effective outcomes. There are medications that include antidepressants that target the neurotransmitters, as previously mentioned, and another type of treatment is psychotherapy, like cognitive behavioral therapy. Medication and psychotherapy can be used on their own, but a combination of both is more effective and usually provided. More recently, though, there has been a growing interest in the acceptance of animal-assisted interventions, short AAI, as a non-pharmaceutical, holistic approach to aid in treating and preventing depression. Anyone seeking AAI can speak to a medical professional and utilize this intervention in their care management. There is no sure way to prevent depression, but proactive steps can be taken to reduce the risk, which include practicing self-care, having coping mechanisms, and getting help when you suspect something's wrong. Lastly, utilizing AAI or getting a pet has also been shown to be effective. Now I will delve into AAI and zoonotic disease burden. So AAI is an alternative or complementary type of intervention using animals as companions for humans in order to improve physical, social, emotional, and cognitive functioning. Also known as animal support or animal-assisted therapy, these animals do not have formal training like service animals. There has been reports dating back to the 18th century with the use of animals as human companions to improve coping mechanisms and health. Most commonly, dogs are used, but research has shown that other animals, including cats and horses, have been beneficial as well for rehabilitation and the reduction of prevalence in depression, PTSD, and anxiety. AAI is more frequently used and accepted today because it is a cost-effective intervention and has been shown to complement recovery in internal medicine, rehabilitation medicine, and neurorehabilitation. Research has also explored the use of dogs in preventing dementia. With a change in environment due to increased human and animal interaction from AAI in treating and preventing depression, as well as other diseases and rehabilitation, issues of zoonotic disease transmission arise. Animals involved in AAI are more prevalent in the public setting, like airports, restaurants, and hospitals, as they are exempt from federal animal restrictions, which leads to more contact between animals and humans. Increased incidence of zoonotic diseases such as toxoplasmosis, Salmonella, and Campylobacter is a growing concern. Signs and symptoms will vary based on the zoonotic disease, agent, and host, but may include GI disturbances and respiratory issues. For animals, they will experience a change in habitat and lifestyle, especially those who were not previously domesticated. In humans, the use of AI may improve depression, but leave an individual susceptible to other human health issues and infections. And lastly, environmental changes can occur with the increased demand of animal use, causing more waste products in public areas, for example, that can affect humans and other species. Changes in climate and natural disasters can also change habitats, leaving opportunities for diseases to be passed on between animals and humans. Anyone who hasn't increased in contact with animals in AAI are at risk of zoonotic diseases and infections. Other vulnerable populations such as immunocompromised, elderly, and children who are vulnerable to infectious diseases in general will be at a higher risk due to an increased use of AAI in public areas. Nevertheless, animals and humans will be at risk in general of emerging diseases due to the increased interaction in a changing environment. In diagnosis of zoonotic infections and diseases from AAI, a medical assessment will occur to guide medical providers and veterinarians in obtaining further diagnostic labs, such as blood samples or stool cultures, to determine the causal agent of the symptoms. In addition, this will determine the correct course of management and treatment for the zoonotic infection or disease. Medical professionals deal with the health management in humans, while veterinarians serve as advocates for the health and welfare of animals participating in AAI, and serve also as the experts in zoonotic disease transmission. Preventing zoonotic diseases is a challenging issue since AAI use has increased. General precautions can be taken, like washing hands after handling animals, or ensuring regular health checkups for both animals and humans, along with vaccinations, so that this can decrease the likelihood of zoonotic transmission. In management, veterinarians serve as, once again, advocates for health and welfare of animals, and humans serve as advocates for health and management in human health. Since this is an emerging and evolving issue, joint efforts through One Health in developing better prevention, management, and control of zoonotic diseases with the increased use of AI is needed. In doing so, we can ensure that the health and safety for both animals and humans in achieving optimal health will occur for all. Thank you very much. And here are some references in case you would like to get further information. Thank you.